Hello, hello, hello. Welcome to Be Bold America. I'm your host, Jill Cody, along with my co-host, Dr. Pettis Perry. How are you today, Pettis?
I'm doing really well, my friend. It's a
Nice
gorgeous
to hear
day
that.
up here
Good.
in the Pacific Northwest. Sun for a change.
Yay,
It's
we have
awesome.
sun too. Our program today is The Plot to Take Away Your Medicare Unveiled. When Willie Sutton was asked why he robbed banks, he responded, "Because that's where the money is." Well, there is lots of money to be stolen from Medicare. There have been eyes on stealing it for decades. During the final days of the Trump administration, officials at the Center for Medicare and Medicaid Innovation launched a dangerous and insidious pilot program known as Medicare Direct Contracting to privatize the system. One name you may know it by is Medicare Advantage. About 50% of Medicare has been aggressively privatized already. At what point will Medicare be shut down so it will be completely in the hands of private investors who want to profit from it? 60%? 65%? It could happen in the next couple of years, and we must stop it. We have big things to do. Pettis, would you like to introduce our guest today?
It'd be my pleasure. Dr. Anna Malino spent decades working as a pediatrician with immigrant, refugee, and underserved children in Ohio, Texas, Pennsylvania, and California. She's a past president of Physicians for a National Health Program, also known as PNHP, a co-founder of Healthcare for All Texas, and the lead organizer for the National Single Payer System. She's authored opinion pieces on how a national single payer system will improve patient health care and bring us closer to social justice. She's been a speaker on healthcare reform and featured on national and international television and radio. She recently retired as professor of pediatrics from the University of California in San Francisco. Welcome to Be Bold America, Dr. Malino.
Oh, thank you so much. It's such a pleasure to be here with you today.
Jill?
It's a pleasure to have you. I saw a lot of activity when I made the social posts on this one, so I think there's a lot of interest around the Medicare topic. So, Dr. Malino, the current president of PNHP, Susan Rogers, has said, Medicare was designed as a lifeline for America's seniors and those with disabilities, not a playground for Wall Street investors. So why don't you begin at the beginning and explain to us why Medicare was created? This national program has been serving senior Americans for decades now, and I think many people have lost track of the reason why it was created in the first place.
Thank you for this excellent question, Jill, and thank you for having me on your show today. It's
Our
a real pleasure to be on Be Bold America and speaking with you and Pettis. So it's really good to remember why Medicare was created, especially if, we are being threatened with its extinction through privatization, as you mentioned. Medicare, just a little bit of history, was signed by President Johnson in 1965 to cover the health care needs of seniors over 65 years of age. And people don't remember that prior to the passage of Medicare, 50% of seniors lived in poverty. And Medicare was the single most powerful event that lifted seniors out of poverty. Medicare has changed over the years for sure. For example, more people are now eligible, not just the seniors, so people with end-stage renal disease, so for dialysis, and people with ALS, that's Lou Gehrig's disease, can also enroll in Medicare, as well as some individuals with disabilities. And it really is a beloved and trusted public program, but it is not perfect, as anyone on Medicare will tell you, although they will fight you to the death if you want to take it away from them. Now, since 2003, Medicare has become more and more private and less public. Now, to make things a little simpler, I like to think of Medicare like a pie that's cut into two slices. The traditional slice with Part A and Part B and Part D and a supplemental plan, and then the Medicare Advantage slice, which you talked about, mostly run by for-profit corporations that get paid by Medicare as the middleman to manage the care of millions of seniors and people with disabilities. Now, this is maybe a little boring, but it's really important to understand this point, and that is that the insurance company middleman gets a monthly lump sum at the beginning of the month from Medicare for every enrollee. This is known as capitation. The idea is to control costs, but the incentive is to keep as much as possible of that monthly lump sum and pay as little as possible for health care for that enrollee. And that's why there are prior authorizations in Medicare Advantage and narrow networks and delays and denials of care. Now, as long as you are healthy, Medicare Advantage will work for you. But when you get sick, when you really need that health care, it stops working. Now, when compared with traditional Medicare, the Medicare Advantage plans cost the government more. And this is threatening to bankrupt Medicare as we speak. And they do not provide better care in the end. But because they're overpaid by the government, they can offer lower monthly premiums and some other extras. And, if you are a senior on a fixed income, that lower premium, sometimes zero monthly premiums, is really, really attractive. And these things are not offered by traditional Medicare. So Medicare Advantage keeps recruiting more and more seniors into their plans. Now, back in 2003, a tiny slice chose Medicare Advantage. But today, as you mentioned, almost 50% of seniors and people with disabilities choose Medicare Advantage. And before we know it, most of Medicare will be run by insurance companies.
Well, can you explain the threat of Medicare direct contracting? Are they also known as DCEs, direct contracting entities?
Absolutely, absolutely. And this really has been a little bit in the news. And I think at this point we should probably define privatization, because that's really what we're talking about. So the definition is the transfer of control over public goods into private hands. I don't know if you're both familiar with the excellent book called The Privatization of Everything by Donald Cohen and Alan Mikayon, and I highly recommend it to your listeners because they tell us why privatization is so bad. And I will just quote, they say, privatization facilitates the upward transfer of wealth, exacerbates inequalities, creates powerful interests, separates us from each other, and segregates us by race and class. So it's very, very dangerous. And today we're seeing the privatization of public programs in every sector of healthcare. In the exchanges, that's the marketplace, right, that is pumping billions of dollars to private health insurance companies. We're seeing privatization of Medicaid. 70% of Medicaid beneficiaries belong to what they call a Medicaid MCO, which is a managed care organization. Medicare Advantage, as we're seeing, and even the VA. These are all public programs. But, also through these private equity acquisitions of facilities which get a lot of Medicare dollars. For example, hospices, dialysis centers, nursing homes, and home care agencies. They take care of Medicare beneficiaries, and then Medicare pays the bills. But back to your questions about direct contracting entities, remember as we talked about, half of Medicare is Medicare Advantage, privatized, right? And the other half is the traditional Medicare, which is still a public program without any middleman to take a cut. Now, if you're on traditional Medicare, what happens when you go to the doctor bills Medicare, Medicare pays the doctor, there are no prior authorizations, there are no barriers to care, no denials, no delays. Simple enough, but not so fast. A new program called direct contracting, as you mentioned, launched in the waning days of the Trump administration, created for-profit, investor-owned middlemen straight out of Wall Street called direct contracting entities, or DCEs, that's another way to call them, to manage the care of seniors and people with disabilities on traditional Medicare. So it's sort of like Medicare Advantage in traditional Medicare. And what used to be simple, now it's complicated by a middleman who gets that monthly lump sum, right, with huge incentives to make a profit and deny care. And there are lots and lots of dollars to be made, as you mentioned. In fact, the entire Medicare budget for 2021 was an astronomical $1 trillion, which means the traditional Medicare budget, right, 50% of it is about $500 billion per year. And this is the kind of money that keeps capitalists up at night. DCEs threaten to privatize the rest of Medicare, and soon enough, there won't be any Medicare for all left to fight for.
Well, I wanted to share a tweet that I read just this past April by David Atkins. He's elected Democratic National Committee member for California, and he runs a qualitative research firm. And he tweeted, Elon Musk is trying to buy conversation. Peter Thiel is trying to buy a dictatorship. Jeff Bezos is trying to buy the marketplace. Mark Zuckerberg is trying to buy our minds. Taxing the rich isn't just about helping the poor. It's about stopping them from owning everything. And I thought if I followed that same reasoning, direct contracting entities are trying to buy our bodies. So can you elaborate more on the role of billionaires in all of this?
Well, you're absolutely 100% right that everything is being privatized, and we are really in facing a catastrophe because our public dollars are being siphoned to these private corporations. So, for example, you ask, are they, making money off of that? But, I'm not sure if there is like a dollar figure for each individual, although I'm sure that health corporations, health insurance actuaries probably have that information. But I can tell you that Wall Street speculators have increased the historical average valuation of a Medicare beneficiary of a Medicare beneficiary, because believe it or not, Medicare beneficiaries are valued in the stock market, amazingly enough.
Because we're a body that they can profit from.
Exactly.
We're on the stock market. Oh, boy.
That valuation has gone up from a historical $7,000 per year to $87,000
oh, my.
per year. And part of that increase in valuation is due to the hopes that Wall Street is pinning on direct contracting.
Oh, gosh.
Yeah.
Oh, my. It just makes me so angry. So aren't direct contracting entities that we've been talking about here based on dangerously flawed model? What is the model?
Right, that they're based on. Right. For. Yeah, absolutely. So there are many different ways of answering that question, and I will try one way, and that is that it's a model that puts investor-owned private equity firms, venture capitalists, and commercial insurers between doctors and patients. Now, can you imagine having a private equity firm in charge of seniors' health care? Like if you're on Medicare, in charge of your Medicare, or in charge of your grandparents' health care? Will their bottom line be to provide the best health care possible or to make the greatest profit? And I think we know the answer. Now, DCEs using this model threaten to radically transform Medicare from a public program, right, to a privately run program. And they really do threaten to transform Medicare in this way. And the big question really becomes is, how are these seniors, right, who rejected all the Joe Namath Medicare Advantage ads, who signed up for traditional Medicare, suddenly find themselves in this for-profit plan, right? Mm-hmm. How does that happen? Well, you don't tell them. You dupe their doctors and physician practices to join a DCE by promises of higher salaries, more time with their patients, less documentation, and trust me, as a doctor, that sounds very, very attractive. Medicare then goes through millions and millions of bills or claims to Medicare, and if they find a particular senior whose primary care physician has joined a DCE, then the senior automatically, without their knowledge, without their consent, gets assigned to that DCE.
Oh,
so
my.
That's how that's happening.
I want to emphasize that when we come back from our break. You are listening to Be Bold America on KSQD 90.7 FM. Many voices, one station. Listen globally online from the ksqd.org website. Our topic today is the plot to Take Away Your Medicare Unveiled. And we're speaking with Dr. Anna Melano, a pediatrician and past president of the Physicians for a National Health Program, and who has authored opinion pieces on how national single payer will improve patient care and bring us closer to social justice. Visit pnhp.org and protectmedicare.net to learn more. I'm your host, Jill Cody.
Hello, K-Squid listeners. I'm Tom Hartman, and each weekday at 4 p.m., I bring you a different perspective on the news than you're likely to hear on most media outlets. Please join me on KSQD Santa Cruz, your ink spot on the dial for the Tom Hartman program, heard now for the first time ever in the Monterey Bay area at 90.7 FM, weekdays at 4 p.m. That's Progressive Talking Conversation with me, Tom Hartman, weekdays at 4 p.m. on KSQD 90.7 FM. Tag you're it.
If you're just joining us, you're listening to our bold guest, Dr. Anna Melano, past president of Physicians for a National Health Program. And Dr. Melano, I wanted to really focus again on private equity funds because just this month, the latest issue of Mother Jones magazine, the whole magazine is titled Looted: How Private Equity is Stripping America for Parts. And one of the quote in it about stripping America for her parts was, quote, "I'm amazed by how brazen it is that this is happening in plain sight. You don't know what you don't know until it happens to you." And it seems to me that fits right into what you were just talking about, where...
I'm sorry, the connection...
the connection... Are you...
So no, just if you could just repeat your question for me.
Okay. And I just was seeing how that fit in with how you were talking about the private entities will enroll the physician, and then one day the Medicare recipient would just get a letter. Is that correct?
Right, exactly. That's how it's happening. The beneficiary gets a letter in the mail letting them know that they are now part of this direct contracting entity because their doctor has chosen to improve the healthcare delivery for them. But the interesting thing is that back in December, a group of Physicians for National Health Program and I met with Liz Fowler, who is the current director of the Center for Medicare and Medicaid Innovation. So this is we can talk a little bit more about this, but this is the government agency that developed direct contracting in the first place. And I asked her specifically this question: what if a senior finds him or herself in a DCE and wants to opt out? Is that possible? And her response was, yes, they just have to find another primary care doctor.
Oh,
now,
geez.
I was totally shocked.
That's shocking.
You know, that is totally shocking because even if you've had a lifelong relationship with your PCP, or sometimes there are no other primary care physicians in your area, right, if you're in a rural area, that's just too bad. Once your PCP has joined this DCE, either you join too or you find yourself another doctor.
And there's no notice to have this happen to you. There's no requirement that a letter gets sent saying that your physician has selected this. Nothing. You just get the letter.
Right. Well, it's a sort of a fait accompli. By the time you get the letter,
Right.
This has already happened. Right.
It's already happened. So it's just a surprise.
And then to respond to what you said in that Mother Jones article, which is fascinating, thank you for letting me know about that. It's really great.
Yes, it's called Looted: How Private Equity is Stripping America for Parts. And obviously part of America is its healthcare system.
Oh, absolutely. And we're seeing it privatized more and more and more. And, you know, when we first started this campaign late last year, about November, so September, October, November, we visited Washington, D.C. late November to raise the alarm about direct contracting. And very, very few members of Congress had even heard about direct contracting. It's really been an under-the-radar plot by an under-the-radar agency to give a traditional Medicare to Wall Street. And honestly, like everything that's clandestine, there is a reason for the secrecy, right? If people knew about it, they would put a stop to it. And that is exactly what is happening now. And I'm sure the people at the, CMMI, the Centers for Medicare and Medicaid Innovation, are quite surprised by their sudden popularity.
Pettis, I know you have some questions. Over to you.
Thank you very much. This has been a fascinating conversation. I was going to ask you a couple of rudimentary questions, but I think since we've gone so far with privatization, I'll ask something about privatization, and if we have time later, come back and ask the rudimentary questions. You know, you spoke about we're privatizing everything, and we really are. We've privatized utilities, our phone companies. There's assaults on voting rights, so we're taking the ability of people to make choices there. Abortion rights, Rick Scott came out last week with his initiative to end Medicare or privatize Medicare by within 5 years, or sunset Social Security in 5 years. We've privatized education, we've privatized prisons, and now we're talking about privatizing Medicare by 2030. I listened to one of your podcasts or your posts from the Tom Hartman show, and a person by the name of Gabe Dropos, I hope I pronounce his name correctly, in September of 21, wrote a blog that was, the way I read it, was criticizing what you were saying. And one of the things he said, and this is a quote, "Direct contracting isn't privatizing Medicare. It employs public-private partnerships to improve Medicare. This type of partnership can and should coexist with goals around Medicare for all." Can you talk to our audience about what's happening with these kinds of statements? Are they genuine? What's your assessment of what he's trying to do?
Well, I completely disagree. I completely disagree with that. Direct contracting is privatizing healthcare. Privatizing Medicare. It's privatizing traditional Medicare. And when he talks about, I've read the article and I completely disagree with him. When he talks about the public-private partnerships that could help us to promote or to achieve Medicare for all, it's outrageous. It's outrageous. Privatization has absolutely no place in the public sphere of Medicare. When you start giving, siphoning money to middlemen, to corporate for-profit middlemen, to try to improve the care, to coordinate the care, to manage the care, we have had decades and decades of experiments with these models, and we know that at the end of the day, costs go up and care goes down. So, all I can do is just show you the evidence, right? But Unfortunately, evidence oftentimes is no match for profit.
Yeah, I wanted to give you a chance to respond to that and to clear up the record. I agree with you. I'm not sure what his qualifications are, and that's one of the problems.
Pettis, what was his name again?
Gabe Dropos, Drapos, and it was on Pearl. Was the blog.
Gabe Dropos.
Right. So Pearl is a DCE out of New York, and they have a blog. And Gabe is one of their writers, and this is obviously they are promoting their brand, right?
Well,
DCE.
Yeah, he has to spin it his way. I mean, in the climate crisis world or environmental world, we'd call it greenwashing, but he's Medicare washing, I guess. He's just putting out the false narrative and confusing the issue and confusing seniors by doing so.
Absolutely.
And that's part of the problem.
Absolutely.
That is.
Absolutely. Mm-hmm. It is a huge part of the problem because people are really not aware. And so that's why I love these kind of programs that raise the awareness of what's going on.
Pettis?
I'd like to talk to you a little bit about the patient's view of healthcare, or what happens to patients in real terms. And I'd like you to correct me if I have this wrong, so please listen for a second and let's get the truth out here. It seems to me that the cost of healthcare is going up to patients, and the quality, as you've noted, has really gone down. For example, I had a dental plan that covered 1/3 of my actual expenses for my treatments, plus I paid the cost of the premiums. So I got less than what I had previously gotten from the same company, by the way, but it was outside of employer health care. So there was a variation that's given to people who are single and applying for care. The other thing that I've heard doctors complain about is just the sheer amount of administrative cost that's related to filing for claims and collecting their end of what's due to them, and that insurance companies essentially dictate what type of care and how much care a person is going to get from a particular doctor. And I'll give you one example. I know a PT who pretty much refuses anything other than Medicare in terms of insurance companies. And he was telling me that the insurance companies will actually say you only get so much time or so many units to do a particular treatment. And they're treating everybody, they're treating healthcare as though everybody is the same and presents in the same way. So can you talk a little bit about the dynamics between the doctor and the patient when you have healthcare that's controlled by insurance companies rather than the physicians?
Well, thank you for that question, Pettis. It's just a sad state of affairs. Everything that you say is correct. Administrators, the number of administrators have gone up since 1970, 5,000%, right? And the reason that we've had to go up by 5,000% is because healthcare is no longer a transaction between the patient and the doctor. That has become privatized. It's become commercialized. It's become commodified, right? And so private insurance companies do have an incredible power over who gets what and what they get. And so for physical therapy, you're absolutely right. So now we're sort of commingling here. We're talking about private insurance from employer-sponsored health insurance versus Medicare, right? But it's basically the same idea that for physical therapy, for example, you might only get 7 sessions per year or something like that, according to your insurance plan, and another insurance plan might give you 10. And another insurance plan will give you something different. What we really need is a system where everybody gets the exact same comprehensive plan, but which would end up actually not only improving care for everybody, but it would also be lowering costs. The basic premise in in U.S. healthcare policy is that the flawed reasoning is that high costs in the United States compared to other countries, which we outspend almost every other country by twice as much. The high costs are due to 2 reasons. One, greedy American doctors because they order too many tests or perform too many surgeries, so that they get paid, for volume rather than value. And 2, greedy Americans who get too much health care. But when you actually look at the evidence and you compare the U.S. with other high-income countries, you see that we do not overuse medicine. Our problem is too little care, not too much. Now, I'm not going to tell you that there isn't overuse. In some instances, there is, and that's bad as well. But that's not the reason why we outspend every other industrialized country in the world by twice as much. But according to this flawed reasoning, to control costs, you control the amount of care doctors give by inserting a middleman, which is usually a for-profit middleman, to manage the care of either seniors or the people in your health plan. And we've been trying to control costs through doctors since the advent of the HMOs in the 1970s, and then with, just talking about Medicare, through the accountable care organizations, and now DCEs, and now REACH that we can talk about in a minute. And then to control these greedy Americans getting too much health care, you create, the skin in the game, which is such a horrible, horrible term. Of course, we all have skin in the game. But you create this by high deductibles and copays and coinsurance. So basically what you're trying to do is you squeeze the doctors and then you squeeze the patients. But what happens is that corporations make great profits. And no wonder this hasn't been working to control costs. The answer, of course, is staring them right in the face, right? Used by countries all over the world who succeed in controlling healthcare costs, and that's national, single-payer, improved Medicare for all.
Well, what I think is the immoral part of all of this is that others are making profit over our suffering. You know, we go to the doctor because we're suffering from something, from allergies or cancer, but they're making a profit off of that, and I just think that's immoral. Thank you for listening to us, and our topic today, the plot to take away your Medicare Unveiled. And we're speaking with Dr. Anna Melano, a pediatrician and past president of Physicians for a National Health Program. Dr. Melano has been a speaker on healthcare reform and has been featured on national and international television and radio. Learn more by visiting pnhp.org and protectmedicare.net. Pettis and I would like to add you to our news group, and you may do so by texting Be Bold America at 22828. Text Be Bold America at 22828. Our list is growing, so thank you for signing up. We will be right back with our bold guest, Dr. Anna Melano, right after this week's Hightower Commentary, where Jim remarks on how to get Congress to reform our broken healthcare system. I'm your host, Jill Cody.
For $3.5 trillion a year, shouldn't we Americans have a world-class healthcare system? Yet, while we spend the most of any advanced nation in the world to get care, more than $10,000 a year per person, we get the worst results. No surprise, then, that the Medicare for All idea is now backed by 85% of Democrats, 66% of independents, and, get this, 52% of Republicans. So why isn't Congress responding to this overwhelming public demand for universal coverage? I suspect that one big reason for Washington's big yawn over the people's plea for sweeping reform is that our lawmakers do not personally feel the financial pain and emotional distress that are inflicted on millions of regular Americans by a system built on private greed. After all, their health needs are met by a double dose of the socialistic care that they so furiously deny to our families. First, they're given big taxpayer subsidies to cover the cost of their insurance, with you and me paying about 72% of the price. But second, there's a secretive medical center located right in the U.S. Capitol building that provides a full-blown system of healthcare socialism to our governing elites. Called the OAP, Office of the Attending Physician, it provides a complete range of free medical service for lawmakers. No appointment needed and no waiting. They walk in and doctors, nurses, technicians, pharmacists, and other professionals tend to them right away. No need to show an insurance card, and they never get a bill. But they do get what a former OAP staffer calls the best health care on the planet. Thus, members feel no urgency to restructure a system that's working beautifully for them. This is Jim Hightower saying, so to get good care for all of us, we might start by taking away the pampered care that lawmakers have awarded to themselves.
What do the corporate powers from Wall Street to Walmart have in common? They hate the Hightower Lowdown. You can see why at www.hightowerlowdown.org.
Welcome back. We're listening to Be Bold America. You're listening to Be Bold America. Everybody's listening to Be Bold America on KSQD 90.7 FM. Many voices, one station. Listen globally online from the KSQD.org website. Our topic today is the plot to take away your Medicare Unveiled. And our guest is Dr. Anna Melano, a pediatrician and past president of Physicians for a National Health Program. And Dr. Melano, Pettis brought up something, but I think I'd like to spend a little bit more time on it, and that is Rick Scott's 11-point plan to, quote, save America. And he wrote this plan, and I would encourage people to take a look at it for themselves. You can just Google that, because he wrote it right after Mitch McConnell said, when asked if you are in charge again, what would you do? What policies would you have, programs for the country? And Mitch McConnell said, "Well, we'll tell you after that. We'll tell you when we're in charge." Well, the hubris is beside the point. But then after that, Rick Scott came up with an 11-point plan, and his quote was, "Americans deserve to know what we will do when given the chance to govern." So just to hang in there with me, because I want to read the very beginning of this plan and then relate it to Medicare. He talks the very first couple of paragraphs. It says, "The militant left now controls the entire federal government, the news media, the academia, Hollywood, and most corporate boardrooms, but they want more. They are redefining America and silencing their opponents. Among the things they plan to change or destroy are American history, patriotism, border security, the nuclear family, gender, traditional morality, capitalism, fiscal responsibility, opportunity, rugged individualism, Judeo-Christian values, dissent, free speech, colorblindness, law enforcement, religious liberty, parental involvement in public schools, and private ownership of firearms." I don't know why he didn't add the kitchen sink into that. But then he says, "Is this the beginning of the end of America? Only if we allow it to be." And then he goes on and says, "Americans are afraid to speak their minds for fear of being silenced and canceled by the woke elitists." So in his 11-point plan, number 6 is where he talks about, and this is, I'm reading the beginning of that number 6 bullet point. "Many government agencies should be either moved out of Washington or shuttered entirely. Yesterday's old government is fundamentally incompatible with the digital era. The permanent ruling class in Washington is bankrupting us with inflation and debt, so they must be removed. For you to have more, Washington must have less." And then the bullet point underneath that affects Medicare and Social Security, but they don't say it. Again, it's this very subtle way of destroying those two programs. The bullet point underneath that is, "All federal legislation sunsets in 5 years. If a law is worth keeping, Congress can pass it again." So that means Social Security and Medicare would sunset. But what would happen in 5 years if the Republicans were in control? I mean, it's just stunning to me how they don't talk about Medicare or Social Security. They don't say the words, but they slip in a way to, again, destroy it. Your thoughts?
Well, when I read that, I was horrified as well. These individuals believe in the market and that if we privatize everything, things will run much better. And sadly, we have case after case where privatizing, instead of making things better, made money for the privatizers at the expense of the people. So, for example, compared to their not-for-profit counterparts, the for-profits in healthcare have higher administrative and overhead costs, especially involved in increasing revenues, and much higher compensation for CEOs and greater likelihood of fraud. So, my belief is that instead of shuttering the government, we should be improving it, because there are plenty of things that are wrong with the government. It is true. And that's what the democratic process is all about. We should be making it great. We should take the profitizers, right, as you call them, out of the commons, out of the public good, and give control back to the community.
Well, the thing about government is it's the only entity large enough to fight corporations. You and I and Pettis as individuals and people listening now and on the podcast, we can't defend ourselves very well individually. And that's what our government is all of us together working for the common good. And they want to destroy that because divide and conquer. No government, there's no coordination of the individuals in the country. Pettis, I think you had another question.
Yeah, I do. Thanks, Jill. Isn't our healthcare system supposed to be designed to not only treat the ill and people who are injured, but also sustain some sense of, preventive health regimens like wellness or wellness checks or fitness or healthy living practices? Are any of these practices built into any of the current systems? And then attached to that, I'd like you to explain a little bit more about Medicare Advantage versus Medicare Supplement or Gap insurance, if you could.
Wow, okay. I will do my best. As far as prevention, you bring up a really great point. So if you are an insurance company and you know that most people are going to be changing their insurance maybe every 18 months or so, every 24 months, so it's very, very short-lived. The insurance company itself has absolutely no incentive to keep their beneficiaries healthy, right? Why would they do that? Because they're not going to be around in a couple of years to reap the benefits of that prevention. Some other company is going to be reaping the benefits. So there's no incentive there for prevention. Unfortunately, our healthcare system really is based on this insurance industry, which is based on a sickness model rather than wellness or fitness model, as you mentioned. Now, the question about supplemental insurance. Let's go back to Medicare, right? Medicare is either traditional Medicare or Medicare Advantage. The Medicare Advantage is like you sign up for a commercial insurance plan, just like, when you were employed, you had an employer-sponsored health insurance plan. Now, when you're on Medicare, you can sign up for a plan as well. If you do not sign up for a commercial plan, then you remain on traditional or original Medicare. Now, traditional Medicare is not simple. It is made up of Part A, which is the hospital payments. It is made up of Part B, which is the outpatient, like when you go to the doctor, when you get, x-rays, when you get a CT, when you get labs. And then there's Part D that covers the prescription drugs. Now, Part B is interesting because while Part A covers 100% of your hospital costs, Part B only covers 80% of your outpatient costs. So in order not to be stuck with having to pay for that 20%, because, you get an MRI that could be $1,000, you do not want to be stuck paying 20% of that. What we created was something called a gap insurance or supplemental plan, so that when people sign up on Medicare, when they sign up for Part B, they most of the time, about 60% of seniors that are in traditional Medicare with Part B also sign up for a supplemental private health insurance plan that pays for that 20% that Medicare doesn't pay for. And that's what the supplemental gap insurance does. It has nothing to do with Medicare Advantage because that's separate. When you only need a supplemental plan when you are in traditional Medicare with Part A, B, and D. Does that make sense?
It does. And so what does Medicare Advantage cover? Does that replace Medicare? Or is it a supplemental insurance?
No, it doesn't. No. Remember, if you think of Medicare, right, all the, as a big umbrella, as a big pie, right? You slice that pie in half into two slices, right? On the right, you've got 50% of the people that have chosen Medicare Advantage, which is a private health insurance plan. And, you pay premiums to Medicare Advantage, although, they've managed to bring down premiums quite a bit. And they also provide you with prescription drugs. Some of them provide with a little bit of dentistry, a little bit of vision, out-of-pocket caps. That's Medicare Advantage, right? Which is great because it's cheap. And if you're healthy and you do not need health care, Medicare Advantage is the plan for you. However, we all get sick. At some point, we all get old. That's a good thing. And we all need health care. So the day that you are old, the day that you are sick, having a Medicare Advantage plan that is cheap because it has narrow networks, because it has prior authorizations, because it has denials of care and delays in care, it's not good to be on Medicare Advantage. Now, the other side of the pie is the traditional Medicare slice of the pie. Under traditional Medicare, what you do is, as I said, it's a little complicated because it's not just like one thing. It's made up of parts. It's made up of the hospital part, it's made up of the outpatient part, and it's made up of the pharmacy part, and it's made up of a gap plan or a supplemental plan because the outpatient part only pays for 80% of your costs.
And this is
you need. Go ahead.
And this is a good time to take a break. If you're just joining us, we're speaking with our bold guest, Dr. Anna Melano, a pediatrician and past president of Physicians for a National Health Program. Dr. Melano has been a speaker on healthcare reform and has been featured on radio and national and international television. I'm your host, Jill Cody.
And you're in tune to K-Squid, 90.7 FM, ksqd.org. Stay tuned. Coming up at 6 in just about 15 minutes, we have a broadcast of On Being as host Krista Tippett speaks with British psychologist Kimberly Wilson. Wilson works in the emerging field of whole body mental health, which is an astonishing new frontier. Perhaps you've heard about the gut microbiome, or the power of neurotransmitters, or the fascinating vagus nerve. The phrase, quote, mental health itself makes less and less sense in light of the wild interactivity we now see between what has been falsely compartmentalized as physical, emotional, mental, and spiritual health. Join us for this inspiring and uplifting broadcast that's coming right up at the end of this program, which is Be Bold America, with your host, Jill Cody.
You are listening to Be Bold America on KSQD 90.7 FM, many voices, one station. Want a friend to hear this interview? I hope so. Be Bold America is available as a podcast. Now you and your friends may listen from your favorite podcast platform, such as Apple, Google, Spotify, Radio Public, and many more. Subscribe for free. So, Dr. Melano, at this point, we like to talk to our guests about what we can keep doing, stop doing, and start doing. But I do have a couple of more. I do have another question and then a couple of comments and questions that I got when we sent out the announcement for this program. The question I have is, it seems to me that the Biden administration supports this profitizing because they renamed the program REACH. Am I correct? What is the Biden administration doing about investor direct assault on Medicare?
This is a great question, and thank you so much for asking. So you would think that the Biden administration would have put a stop to this Trump program, but sadly, he didn't. His administration changed the name from direct contracting entities to something called ACO REACH, that stands for Accountable Care Organizations, Realizing Equity, Access, and Community Health. But other than the name change and some cosmetic changes, I see very little difference between DCEs and ACO REACH. So REACH still assigns seniors without their knowledge or consent. They are still for-profit middlemen owned by Wall Street investors. They can still bankrupt Medicare. They can still be scaled up to all of Medicare without congressional approval, and they still have the same motive to restrict care. Now they're wrapping themselves up in the language of equity, and we can talk a little bit about this. So, it's hard to be against it, right? But the truth is that this is one more way for Wall Street to make money off of people in general, and now poor people in particular. So the Biden administration, instead of stopping this program, unfortunately, is opening the door wide open to Wall Street investors.
Well, it's back to looting America for its parts and making our bodies their product.
Exactly.
I did have a comment sent to me, and the person said, "Yet another insidious and dangerous Republican effort. I have a hard time keeping track of them all at this point. But this one does scare me. I'm soon to retire and will have to rely on Medicare. Maybe keep up my healthy lifestyle and keep suicide pills around if things go south. It's good to put this in glaring spotlight to enrage the voters." And one thing I wanted to say based on this listener comment is that the point is to overwhelm us with the social and emotional onslaught. We just can't stop fighting because that's how they win. We just develop apathy or we ignore it, and then they're able to do this. So even though it's overwhelming, we have to keep going. And then another listener who served in Vietnam and receives VA health care, but he has a long drive to get to that care. When he was 65, he didn't sign up for Medicare Part B because he didn't have the money for the monthly payments. Now he says at this age, he can't get Part B without coming up with thousands of dollars. Is there any way he can get health care coverage other than VA and traveling long distances? Is Medicaid or anything available? Because I understand with Part B, if you don't make that decision right at the moment that you're 65, it'll cost you thousands of dollars later. Am I right?
Yeah, you are correct. Unfortunately, this is how it works. There is a huge penalty for people who do not sign up for Part B within, I think, a few months of turning 65. I don't know what to say about this listener. He's in a really tough spot. I think probably what I would do is if there's a clinic close to where he lives, I would recommend that he goes to the clinic and speak with one of their social workers, because most social workers are very savvy and they know what options people have, and they might be able to recommend an option that will be affordable for this person.
Okay, thank you.
Definitely.
Well, another question was about caps. For example, if somebody has a $150,000 surgery, but then the plan only pays for $100,000, and are they liable for the 50? Are there caps in Medicare Advantage or Medicare?
That's another really great question. There are out-of-pocket caps in Medicare Advantage, which is, I believe, something like $5,000, $6,000 a year, something like that, out of pocket. But traditional Medicare does not have any out-of-pocket caps.
Ah, that's interesting to know, too. And just as a side, for myself, when I retired from CalPERS, that group selects my health plan. And so I'm put into a health plan, and it's already Medicare Advantage. So I didn't have that choice to start with. And I think, am I unusual, or is that the majority of the situation when you retire and have other people decide what healthcare programs you can choose from?
Sadly, it's not unusual. More and more unions are choosing Medicare Advantage plans for their members because it's cheaper, as we were talking about, without consulting with the members, by the way. Mm-hmm. There was a huge court fight between the retirees of the New York City municipal employees and their union, who shifted the retirees without their consent to a cheaper Medicare Advantage plan. And the retirees were just livid. They were protesting, and they took the city to court and won the right to remain in traditional Medicare if they so choose. So, no, you're not alone, and I think this is a fight that needs to be happening by retirees all over the country.
Ah, well, also,
and
go ahead.
No, I was just going to say, talking about retirees, I don't know if you wanted me to mention what the Seattle City Council did, is as a result of incredible work by the Puget Sound Alliance of Retired Americans and others, the Seattle City Council passed a resolution demanding that HHS's Health and Human Services Secretary Becerra and President Biden end direct contracting and REACH. And you can follow their great work at psra.org. And not only that, activist physicians got the Arizona Medical Society to unanimously pass a resolution calling for the end of DCEs. And these same activists also got the Arizona Democratic Party to pass a similar resolution. So this is remarkable work by remarkable grassroots activists, work that I hope gets replicated all over the country.
Well, you just segued very nicely into the Keep, Stop, Start, what we can do, because that is a great start, that anyone can go to their city council and replicate what Seattle City Council did, and with them passing the resolution demanding that HHS and the President Biden immediately end Medicare direct contracting entities. We can do that city by city by city. What else? What other ideas? What should people, listeners, keep doing, stop doing, start doing?
Well, keep doing, listening to shows like this one.
Thank you.
where you can learn about the under the radar privatization programs that the corporations don't want you to know about. You should stop, believing that there's nothing you can do, because you can start doing a lot of things. Let's talk about some things that are out there. So as a result of a lot of grassroots activism all over the country, people started signing petitions, writing letters to HHS Secretary Becerra, just like the Seattle City Council, and turning up the heat on CMMI, which is the agency that created these direct contracting entities, to stop DCEs. Now, needless to say, it made the medical industrial complex industry, the commercial insurers, the ACO groups, the health equity investors nervous, and they turned up the heat on CMMI as well. So one of the things that we're doing is over 300 grassroots organizations signed an organizational sign-on letter demanding an end to DCEs. And there is going to be a webinar that is being put on by Physicians for a National Health Program and many other organizations.
Tomorrow.
On May 23rd at 1 p.m., and it's featuring compelling personal stories of seniors on Medicare. Members of Congress are also going to be there, as well as what people can do to stop the privatization of this beloved public program. Will that be
videotaped for people that are listening to the podcast? And I just have 20 seconds.
Yes.
Will it be video?
Exactly.
Okay. So they can go to the
videotaped.
Yeah, good. So they can go to the PNHP website or the protectmedicare.net and see it?
Exactly. They can do all that. And then there's also a petition that you can sign urging President Biden to sign an executive order stopping the privatization of Medicare. And you can call the White House on Tuesday and leave them a message to stop DCEs. And you can go to the website that you mentioned, but you can also go to nationalsinglepayer.com. nationalsinglepayer.com for more information on how to sign the petition and how to call the White House.
Oh, gosh, Dr. Melano Pettis and I are so grateful that you joined us on Be Bold America. Your work is so vital. And, of course, Pettis and I believe Medicare should be expanded and the qualifying age lowered and not profitized. But we appreciate what you and Physicians for the National Health Program are doing. Our future depends on it. And thank you for being our bold and impressive guest today.
Thank you.
Well, thank you. This is a winnable fight. So
Yay.
Please join us. Thank you so much.
You're welcome. Thank you. What's next on Be Bold America? We will be speaking with Mick West, author of Escaping the Rabbit Hole, How to Debunk Conspiracy Theories Using Facts, Logic, and Respect. This is on June 5th at 5 p.m. to hear Mick share why many people passionately believe conspiracy theories and learn his tried and tested approach that emphasizes clear communication based on mutual respect, honesty, openness, and patience. I want to give a special thank you to Be Bold America's program engineer and station program director, Howard Feldstein. You're listening to KSQD Santa Cruz. Many voices, one station. Listen worldwide, online at ksqd.org. Stay tuned on Being with Krista Teppet. My name is Jill Cody.
And I'm Dr. Pettis Perry.
Thank you for listening to Be Bold America. Until next time, keep, stop, start.